Hello, this is Lyudmila, and today I'm going to talk about the current state of US healthcare system with regards to Iron Triangle. The concept of Iron Triangle was first introduced by William Kissax in his book Medicine's Dilemmas: Infinite Needs versus Finite Resources. So basically, it's an equilateral triangle with three vertices, which signify three parameters, that is cost, access, and quality. And increase and decrease in any one of these parameters actually influences the other two parameters as well. For example, if the cost increases, then the access will obviously be negatively influenced. So the desired state of this triangle is that we want the increased access to healthcare, high quality, and at lower costs. This is what we want from the US healthcare system to be in regards to the Iron Triangle. This is like easier said than done. The healthcare cost changes faster than the other two vertices, and as a result of which the other two vertices, that is, or the parameters, that is quality and access, they change according to the escalating costs. It is worth mentioning that the critics of Iron Triangle, they feel that this concept of Iron Triangle, or the model of Iron Triangle, is not one size fits all model that can be applied to a particular population or to the entire population. However, talking about the first vertex, that is the costs, primarily 17.8% or 18% of the GDP is spent on healthcare. This is approximately 3.2 trillions. And the Medicare spending, talking about the Medicare spending, it is 20% of national health expenditure, and the Medicaid spending is 17% of the total NHE. And a person spends on an average a total of $9,000 to $10,000 per year on healthcare, and this is 2.5 times more than other developed nations. Most Americans, including top-notch politicians, believe that cost is a very unfortunate thing in healthcare. That is, the costs are always is continuously increasing. But however, the US has the best healthcare system. But however, this may not be true, because a recent report of OECD, that is an Organization for Economic Cooperation and Development, the report says that this may not be true for the US healthcare system. That is, first of all, OECD it's an international economic forum which comprises of 34 nations, and those nations are mostly the developed nations. This report says that in US there are fewer physicians per person, fewer physicians per person as compared to the other OECD countries. And also in US, the number of hospital beds was just 2.6 per 1,000 population as per the 2009 report, as compared to 3.4 for the other OECD countries. However, the brighter side to this report is that US does leads in certain things, and that is healthcare research and cancer treatment. For example, the 5-year survival rate for breast cancer and colorectal cancer is maximum for US as compared to other OECD countries. US spending is much greater for all categories of care, especially ambulatory and administrative costs. Like Dr. Leinek's video that was posted, it clearly shows that 33 cents of a dollar is spent on administrative purposes, which is because of the insurance companies paying for the patients, all that, more calls, more faxes, all that administrative stuff. This is in sharp contrast to other countries, especially Canada, Germany, France, and Japan. Many OECD countries use very strong regulations in order to set the prices for the hospitals that they can charge for services. And also some of the hospitals even have allocated set budgets that the hospital can actually spend. A simple example is that a coronary bypass in US is 50% more than what it actually costs in Canada or in other countries, Australia or France. Why there is such a huge discrepancy in the pricing system or in the pricing strategy in US than in other countries, that is too difficult to answer. But two things are clear: that the US physicians are certainly paid more than the physicians of other countries. And also US healthcare system, it uses more expensive diagnostic procedures as compared to other countries. And US healthcare system is always more over treating and over testing. The basic reason is that ours is a very litigious society. The fear of litigation is one reason why the physicians tend to overtest and overtreat. Why? Because they want to play safe. And apart from that, the physicians know that even if they are overtreating, they shall be paid for it regardless of the fact that it is medically necessary or not. And whatever the physician says that a particular MRI has to be done, it has to be done. Nobody questions that, because as a patient, patients tend to follow whatever the doctors tell them. And finally is the access. So far we've talked about cost and quality. Now the access. About 10% of the US population is uninsured, which means that about 29 million people are uninsured. This figure has actually come down after ACA, because ACA has covered a lot of uninsured individuals. But for present day scenario, employers are employer-based coverage is the only best option that is available for a person to access to healthcare. And people who have jobs, they have access to healthcare because their employers they cover healthcare insurance for them. And people who do not have jobs for whatsoever reasons do not have access to healthcare. Coming to this, lack of insurance is another reason. In fact, it's a very important reason why so many Americans die each year. There is this inverse care law. This concept came in 2003, and it says that those people who are without insurance get too little coverage, too little care, whereas those people who have insurance get too much unnecessary care. For example, if you have insurance coverage and you can afford it, then pretty much even if you are not happy with your nose, you can go for a cosmetic surgery. Whereas those people who do not have insurance, they as well may die because they do not have access to healthcare. This is a very unfair scenario. So, talking about employer-based insurance, many of the businesses, they actually have to allocate a majority part of their budget for funding healthcare insurance for the employees. And because of this reason, many businesses have actually failed and gone bankrupt because they have to divert a major part of their budget for healthcare funding than actually concentrating on the delivery of goods and services or the products that they're manufacturing. So to conclude, iron triangle at a particular point of time is always skewed. One or the other vertex is increasing or decreasing and is negatively influencing the other two vertices. As a result of which, like for example, if we increase the cost, the access will be less. If we lower the cost, maybe the quality will be compromised. And if the cost is high, the quality is good, then probably there would be no access for healthcare. So, in conclusion, I would say that we should resort to single payer system as it is in Canada. And Canada is a developed nation, and they are happy with the system. If they can do it, we can also give it a try, because insurance company, that is the middleman, that somehow is the main culprit for escalating costs, for the unnecessary administrative costs that a person has to pay for healthcare. So I think US has already been, it's a great nation. It has never shirked from trying new avenues, new ways to tackle its problems. I think it has to give a thought to a single payer system. Thank you.